These are the items that you will find in the bronchoscopy pack when you open it up. You'll find a Fred sponge along with defogger. You'll find a small white square basin, 4x4s, a specimen cup, a 3 ml non-Lurlock syringe, a 1 ml non-Lurlock syringe, a 22 gauge angiocath, a sharps box to discard the needle from your angiocath, suction tubing, pre-printed labels for oxymetazoline or Afrin, lidocaine, and normal saline, as well as additional blank labels, a marking pen, an orange mat used on the suspension Mayo stand, a medium sheet that's used to cover the drape, as well as the timeout sheet. These are the items that you will find in the pediatric and infant laryngoscope trays. You will find a microlaryngeal suction, a vocal cord spreader, 2 side-slotted or Parsons laryngoscopes, 1 Lindholm laryngoscope, along with the ventilation port for it and the light carrier for the Lindholm. You also find 3 clips. These are used to secure the suction and ports to the bronch cart, a tooth guard, 2 light cords. One is the angled prism cord. This fits on the Parsons or side-slotted laryngoscope. And you also have the standard Storz light cord, and this is used on the light carrier for the Lindholm laryngoscope. In a moment, I will show you how these items are assembled. How to set up the Lindholm laryngoscope. As you can see, I've removed the 3 clips found in the tray to secure the light cord, the light cord itself, which is the standard Karl Storz light cord, the Lindholm laryngoscope, the light carrier for the Lindholm laryngoscope, and the ventilation port for the Lindholm laryngoscope. In addition to these items from the tray, you will need a pair of scissors, an endotracheal tube, usually a 5.0 or a 5.5, suction tubing from the anesthesia cart. First, you will cut off a section of the anesthesia suction tubing. You can discard the other portion of the suction tubing. You will remove the stylet from the endotracheal tube. You will discard the tube. You will attach the connector to the cut end of the suction tubing. You'll take the laryngoscope and slide the light carrier into the side port. And secure it. You will take the ventilation port and attach it to the laryngoscope. Keep in mind that the ventilation port has to be closer to anesthesia. Then you will take the suction tubing end of this and attach it to the ventilation port. Then, when they are ready to ventilate the patient, they will ventilate the patient through this end. The light carrier itself will be attached to the light carrier. The assembly of the Parsons or side-slotted laryngoscope. Blue clips, once again, are used to secure the light cord to the bronch table. I've removed the Parsons light cord. As you can see, there is an attached prism to it. I've also taken out the Parsons laryngoscope. The difference is there is an opening on the side and the ventilation port is attached to the actual laryngoscope. You will take the prism of the Parsons laryngoscope and slide it into the handle of the laryngoscope, all the way up. And you will see that the prism will be the light source during the laryngoscopy. On the ventilation port, you will use the same assembly that you use on the Lindholm. If you recall, it's the 5.0 or 5.5 endotracheal tube connector, a section of anesthesia suction tubing itself. The suction tubing end will be attached to the ventilation port, and anesthesia will ventilate the patient through the same connector during the laryngoscopy. This is the adult laryngoscope tray. On this tray you will find 3 clips used to secure the light cord to the bronch table, a tooth guard, a microlaryngeal suction, the vocal cord spreader or vocal cord retractor, 3 adult-sized laryngoscopes, 2 light carrier clips, and the standard Karl Storz light cord. Momentarily, I will show you how to assemble the adult laryngoscope. The assembly of the adult laryngoscope. As you can see, I've removed the 3 clips from the tray, the standard Karl Storz light cord, the clip-on light carrier, and the laryngoscope. Once again, we have our assembly of the endotracheal tube connector, suction tubing section. You will attach the suction tubing end to this assembly to the ventilation port. As such, you will clip on the light carrier to the laryngoscope, and then the light cord will get attached to the light carrier. And that is the adult laryngoscope assembly. This is the pediatric bronchoscope tray. On this tray you will find 2 telescopes, 4 bronchoscopes of different sizes, 2 prisms, 2 side ports, 2 nipples for each side port, and 2 bridges. You will also find 1 standard Karl Storz light cable, and 1 bifurcated double-ended light cable. How to assemble a bronchoscope. As you see, I've taken out the light cable, the prism, the bridge, the side port and its corresponding rubber nipple, the bronchoscope, the telescope, and the bifurcated light cable. I will take off the protective sheath of the telescope. I will take the bridge and I will attach the smaller end to the telescope. There is a notch on the telescope that the bridge will fit into. Once it is on there, I will lock it onto the telescope. I will then take the bronchoscope and slide it onto the telescope. And it will gently click onto the bridge. You always make sure that the light source for the telescope and this portion of the bronchoscope are aligned, because that is where the light cords will eventually get attached. The prism is then placed only on the first notch of the bronchoscope. The side port will have the rubber nipple attached to it. As you can see, this has a hole in it, and that can be used with a flexible suction catheter. Once this is assembled, this will go onto this portion of the bronchoscope. There is a notch, once again, which it will fit into, and you will hear it click. This is the assembled bronchoscope. Once it has been assembled, you will take the light cord, take one end, and it will get attached to the telescope, and the other end will get attached to the bronchoscope. And this is your assembled bronchoscope. Once again, it's the telescope and the bronchoscope, the side port with the rubber nipple, the bridge, the prism, and the bifurcated light cable. Here is the assembled bronchoscope with the camera and the anesthesia circuit attached to the ventilating port of the bronchoscope. Sometimes they use a gooseneck connector between the ventilating port of the bronchoscope and the anesthesia circuit. As you can see, a flexible suction catheter has been placed in the side port of the bronchoscope. Once it is in the port, it will be attached to suction and secretions will be removed from the bronchus. These are the items that you need for a full laryngoscopy and bronchoscopy. You will need defogger for the telescope, topical lidocaine to anesthetize the larynx, some sort of a laryngoscope, a light cord for the laryngoscope, ventilation apparatus attached to that laryngoscope, a vocal cord retractor or spreader, a microlaryngeal suction, an assembled bronchoscope with the camera, the side port, the bridge, the prism, the light cords. For children that have teeth, you will also need a tooth guard, saline, some gauze, a cup for any additional medications that they might request, a marking pen and labels to label those additional medications. This is a suspension Mayo stand along with the bed clamp used to attach the Mayo stand to the bed. The orange mat is the orange mat that came in your bronchoscope pack. This is a suspension Mayo stand, a Parsons laryngoscope, and a Parsons laryngoscope suspension attachment. The laryngoscope is attached to the suspension by attaching it to this end. The surgeon is able to adjust the angle of the laryngoscope. Once it is at the desired angle, both of the surgeon's hands are free to operate on the airway. Please note that there are two different suspensions. One is for the Lindholm and the other is for the Parsons laryngoscope. The Lindholm attachment has a much thicker and shorter end for the laryngoscope to attach, whereas the Parsons is longer and thinner. If you do not have the correct suspension, it will not attach to the laryngoscope. Both are labeled appropriately.